Leading the charge are the public health officers. Teresa Tam is the federal officer, and each province and territory has their own. They never seek the limelight. Now, though, they are some of the most famous and beloved leaders in the country. Their daily briefings are where Canadians turn to get the facts and learn about the science. BC's public health officer, Dr. Bonnie Henry, is so beloved, she's inspired a fan club, T-shirts, street art, and musical tributes. She's also keenly aware that this virus came out of nowhere, and that makes it very hard to predict where it's going. Dr. Henry, I know you are so incredibly busy. Thank you for taking the time to talk to us. You know, I want to start by asking, when we watched what happened in China and saw what this virus is capable of back in January, how it overwhelmed the hospitals, that it killed even healthcare workers, entire cities were put under lockdown. Did you think what was happening there could happen here? Did you have a, forgive me, but a kind of holy crap moment?
Absolutely, and I think in talking about it with my colleagues, to the media, to the public at the time, we were holding out hope that China would be able to contain this. But it became apparent not long after. I mean, I knew we would undoubtedly have cases in Canada and in BC, just given the travel patterns that we knew around the world. I don't think I was prepared for how severe it was going to be in other countries, particularly when it hit Europe. And many of us, I think, around the world, when we saw what was happening in Italy, was really shocking. These were all the things that we had talked about in preparing for pandemics for a long time, but I never really thought that I would actually have to do them. But I think, here in Canada, we had the luxury of time to prepare us and to help us understand what things needed to be done.
You have so much experience with the SARS outbreak in Toronto, where you helped lead the response, and the Ebola outbreak in Uganda. Those were life and death challenges too. How does what you're doing now compare to that?
I think every pandemic is different. Every outbreak is different. All of them have their challenges. This one certainly is unprecedented in the impacts that it's had around the world. And, as you say, I've been involved with many very serious, very tragic outbreaks. And this one, it just, the whole societal impacts of it have been immense.
You have such a fine balance to keep as a public health officer, informing people but not panicking people, deciding when an ask becomes an order. It's critical that you keep the public on your side throughout this. How much does that weigh on you?
A lot of it weighs on me. It weighs on me, we want to put in enough restrictions to do what we need to do to contain this virus. Right now we know there's no treatment, there's no prevention if you've been exposed. We just need to make sure that we can care for you appropriately and that we do everything we can so you don't pass it on to somebody else. But every single measure that we take, the unintended consequences, the numbers of people who have had their lives disrupted, whether it's from COVID-19 and the tragedies in our long-term care homes, or whether it's people who've had their surgeries canceled, or people who are unemployed because of the huge economic fallout. I think everything about this has been so challenging, and the sort of balance of trying to get just enough restriction to do what we need to do, but not too much. And it haunts me a little bit because you can't ever get it just right. Though there is widespread transmission in some areas of the world, we are not in that position yet.
I know you are a doctor, Dr. Henry, not a TV personality. Your briefings have happened almost every day, though, for 12 weeks now. You've become must-see TV in British Columbia. People are drawing pictures of you and murals of you. I'm sure they're sending you things, and they're writing songs about you.
Dr. Bonnie Henry, we're in love with you.
That's a barbershop quartet in Nanaimo. They love you. It's pretty remarkable, isn't it?
Can you see me blushing?
We're in love with you.
I mean, that was beautiful. They certainly have amazing voices.
I guess what I'm asking is, what do you think it says about how the public is looking to people like you, to public health officers and to experts and to science to lead us out of this?
Well, I am heartened that people are looking to experts and to science, particularly in Canada. And, I've said this many times. What I do is I'm the face and sometimes the voice of a lot of people, and a lot of people who are very committed and passionate and doing the work on the ground. And we are a team. And we are a team across the country. We know each other well. We talk all the time, sometimes daily these days. But it is a privilege and very humbling for me to represent the work that so many people are doing to try and keep us safe in our communities across this country.
The million-dollar question is when this will end. Now, I know there's no precise answer to that. I'm not going to ask you that. But what about an exit strategy, a plan for a ladder, if you like, that we can start climbing to get out of this? You must be working on that.
Absolutely. And in the same way that we were watching China, we were watching Italy, we were watching Singapore, Hong Kong, Germany, we're now watching them and seeing where, in some ways, again, we have the luxury of everybody else going before us. Right now, of course, we are still very much in the middle of things in the United States and across Canada. But we are seeing what measures others are doing and how it works. So clearly watching Wuhan very closely, where they've just lifted restrictions quite a lot. And we have the luxury of some modeling. We have some really brilliant minds that have been looking at this, looking at what we might think of over time. And yes, we are planning from the very first day we put the first measures in place. My goal and my aim and our direction to people was, all right, what do we need to know that we're in a place where we can stop doing some of these things? I think the reality is that some things are going to change for a long time, maybe 18 months, maybe years. Things around distancing, things around cleaning our hands regularly, the things that do protect us, that safe distance between us. Until we have a herd immunity or community immunity, whether that's because people have been infected or hopefully because we have a vaccine that prevents us from getting sick with this virus, we're going to have to do some things for quite some time.
When is it time, Dr. Henry, to tell the public what that strategy is, how it will work when some of the restrictions can be lifted, and how that will happen?
None of us are in the place right now where we can consider how we're going to lift restrictions. That doesn't mean we aren't thinking about it, and we need to think about it, but we need to be realistic about the fact that we have a few more weeks before we can start actually implementing these things. And we'll talk more about what that looks like in the near future. But right now it has to be done in a very thoughtful way and a way that makes sure that we have those surveillance pieces in place, so we know if we're starting to get more cases again that might lead to outbreaks and overwhelm our health system. So it's going to be a fine balance for a while.
We sometimes talk about the cases and the deaths as if they are statistics. They are, of course, and we all know they're individual people. You are making life and death decisions. There must be times when that really hits you.
Absolutely. And, it's the thing that keeps me up awake at night more than anything is, have we missed things? What have we done enough in this area or that area? The tragedies of recently we've had people who've died from this at home. What can we do differently? How can we support people? And the other part of it that's so important is these measures, these unprecedented measures we've put in place across the world. The impact on children, the impact on people who can't, who haven't been able to get their surgery that they need. It's very challenging to reconcile all of those. And of course, everybody who dies from this, who's affected by this, their family, their caregivers, their community. But I also think, that is why people are willing and able and are doing what we've asked them to do around social distancing, around keeping that safe distance for people, staying close to their family, working from home, because we know that if we get sick with this, it is our loved ones, our family, and our close community that we're going to pass it to. So all of us are in this together, and I think, that's the impetus so many of us have to make sure we're doing the right things.